Welcome to the ICU podcast, where we explore the vestibular experience through conversations between patients and the health professionals who care for them.
During this podcast, we invite patients to share their stories and healthcare professionals to ask questions so they are equipped to better care for and truly see the invisible challenges faced by their patients. I'm Kimberly Warner.
And I'm Cynthia Ryan, and we are your hosts on this journey of discovery. Welcome, everyone, and I am so excited today to be talking with our guests about a topic that I think we have not touched on at all in our podcasts, and that is the life of people who live with and love someone who has a vestibular disorder. We know that living with and supporting someone who has a chronic illness can be challenging. First off, I wanted to give a big shout out to all the spouses, parents, friends, and other care partners out there who selflessly adapt their lives around the restrictions imposed by their loved one's vestibular illness. Aborted family events, staying home instead of going out for dinner and a movie, and lots of medical appointments are just some of the complications you might face. And on top of that, there's the worry, will your loved one ever get better? The guilt, could you be doing more to reduce your loved one's burden? And let's face it, the exhaustion. When can you take time to care for yourself? Care partners often spend so much time and energy focused on their loved one's needs, they sacrifice their own. So today, we'd like to shine the light on these unsung heroes and offer them a moment to reflect on what self-care might look like for them. So I'm going to start out by introducing our first guest. Katie Willard-Verant is a psychotherapist living in St. Louis. She sees clients in therapy and writes for Psychology Today about chronic illness. She's a graduate of the Brown School of Social Work at Washington University in St. Louis and of the St. Louis Psychoanalytic Institute's Advanced Psychodynamic Psychotherapy program. She works with adults, adolescents, and children on a variety of issues, including loss and grief, life transitions, and living with chronic illness. Welcome, Katie.
Thank you. It's nice to be here.
Katie, I just want to interrupt for a second. I found you through your Chronically Me column on in Psychology Today, and it is such an incredible resource. So thank you for that.
Oh, thank you for saying that. I appreciate it. I just put a new one out this morning, as a matter of fact. So it's always very nice to hear that people are finding the column and finding it helpful.
Oh my gosh! Well, we'll have to talk about what your latest issue was. I'm really interested to hear.
Great.
So I'll also introduce Christina Mullen. She's our care partner today, representative care partner. She has been married for 7 years and is a mother of 2 children, aged 7 and 5. She enjoys hiking, skiing, traveling, and cherishing moments of fun with her kids. 4 years ago, her husband was diagnosed with Meniere's disease, and since then, he has also been diagnosed with ankylosing spondylitis, which is a mouthful, vestibular migraines, and PPPD. Despite these challenges, Christina remains committed to her family and her passion for helping others. Professionally, she is a licensed clinical social worker in a middle school setting where she dedicates her career to supporting students and their well-being. Additionally, she started a blog called Sunshine Parenting in Chronic Weather, where she shares her experiences and insights on being a spouse and a parent while navigating the complexities of chronic illness. So Christina is going to bring a wealth of experience to us today. Welcome, Christina.
Thank you. Thanks for having me.
Yeah, let's just jump right in. I know you have a long, winding story, but can you jump in and tell us a little bit about your husband's diagnostic process and what that was like for you?
Okay. Well, we're still going through it. Depends on the doctor, depends on the day, what symptoms, what medications he doesn't respond to. But we'll say 4 years ago, he had his first vertigo episode, We didn't know what was going on at the time. I thought he was dying. He texted me to come downstairs. I was taking a nap, so I was highly annoyed because I had just gone back with the kids and it was his turn to watch them. And he was laying on the floor and he's like, I can't move. I'm like, do I call the ambulance? And he was like, nope, I'm fine. Just give me some water. I'll be okay. He couldn't move. It was very scary. I encouraged him to go to the doctor. He said no. Fast forward a week, he had both of our children at the zoo. I got a call at work from him. You need to come to the zoo now. I can't make it out of the park. I have both kids. Sorry, it was really hard. But
Yeah.
I got him and the kids were okay. They were like 3 and 2 or really young. I think that was their ages. It was really hard. But since then, after that, he slowly got a Meniere's diagnosis. Actually, pretty fast, according to like the Facebook websites. From what people said, they're like, "Oh, that's really fast." It was a couple of months. At first, they thought it was BPPVD or BPPD.
Yes.
Yeah. It's
All of those
BPPV.
P's and D's and V's and
Yeah.
dizziness. Yeah. So they said it was Meniere's, and then the lady, one of the assistants doing it, goes, "No, you just have BPPVD or whatever it is, and you just have to do this." So he called me at work. I was beside myself. I was like, "The nightmare is over. He's just going to have this little routine thing done, and he'll be fine." Yeah, it didn't work. Then the doctor was like, "Oh no, he did his ECOG and all of those fun assessments," and they were like, "Yeah, it's definitely Meniere's." And I'm like, "Okay, well that's great. We have a diagnosis. There's a cure for diagnoses. It's not terminal. Everything has medicine." And he was like, "No, have you read about it?" And I'm like, "Yes, you can do this surgery." He's like, "It's not a little surgery. It's a major surgery. It doesn't work for people a lot of the time. It can really damage them," according to what he had read. And so I was like, "Oh, well, that's okay. We'll still do it anyway." He's like, "No." So then we started doing other things and looking into it, and it just kept getting worse and worse. And he got vestibular migraine diagnosis from a different doctor. Then we went to a neurologist, and he backed up the vestibular migraines, put him on medication. He's never responded to any medication. And the doctors just keep prescribing the same medications over and over and not sure why he's not responding. And so then they're like, well, maybe this isn't the right diagnosis. And I don't know. It's still going on. It's still a process. There's still it's almost good in a way because I have a few things up my sleeve that I think it is for my research. And I'm like, we'll fix it. This will be great. They've made a mistake. But yeah, I don't know if
It's
that all
such
makes
a
sense.
long journey. I'm sure you've been learning with this vestibular process. At least it sounds like he's got other diagnoses in the works as well. But with vestibular alone, that can take so many years and so many doctor's appointments and hope, and then loss of hope. I just feel for you because it's so intense.
Yeah, and just watching him go through the hope. Oh, I think it's this, and I'm really responding to this new diet that I read about, and then it doesn't work, and he has another attack, and the depression sets in, and then I'm like, oh,
yeah,
it's hard. Christina, interestingly, my mother has Meniere's disease and vestibular migraine and BPPV, so I have kind of been on the care partner side in a way because I grew up with someone with these illnesses. Although as a teenager, you don't really connect with what's going on. It's something major, but I've seen the progression throughout her life. That it is a journey, and it is hard to be the one on the outside. And honestly, until I started working for Vita 14 years ago, I don't think that I really took it into myself what my mother was going through. It was this thing that she was dealing with and not, and then I started talking to so many vestibular patients, and I'm like, oh, that's my mother's story over
Mhm.
and over again. So yeah, it is really hard to put yourself in the position of the person who's struggling with this, but it's equally hard to be the
Mhm.
person looking out, or looking in from the outside and wondering what you could do it, and also
Mhm.
how it affects you, and the rest of your family. So kudos to you for advocating and
Mhm.
doing your research and learning about it, and as hopefully we'll talk about later, figuring out ways to care for yourself.
Mhm.
So Katie, I'm
Yes.
curious, how did you start working with people who have chronic illness as a psychotherapist? How did that become a focus for you?
Sure. I actually have lived with Crohn's disease, a gastrointestinal disorder, since I was a teenager. I did not go into social work / therapy thinking I would work with chronic illness. However, as I did my training, went through school, I saw that the need was really great. I saw how many misconceptions there are about chronic illness, one of which I think we just illustrated here, that our medical system is such and our culture is such that we imagine illness to be you get sick, you go to a doctor, you get medicine, and you get better. And for those of us who live with chronic illness, of course, that's not our case. It's a journey. I think you used that word, Cynthia, and I like that. It is a journey. So having that perspective personally, I found that I was able to bring that into my work as a therapist, and that there was such a need for that, for people to be met with care that had that innate understanding that this is a journey. This isn't a one and done fix. This isn't your fault. There are days that are very dark. There are days that you can live pretty normally and it's okay. So I think my personal perspective of that's been a gift to me at this stage of my life, to be able to use that experience to help other people struggling with similar issues.
That's such an important perspective that you would be surprised how many therapists don't have that.
It
I mean,
is
it's not even
quite
part of their
surprising.
training.
Yeah, yeah. No, I've been very fortunate at our Wash U here, the social work school. I've spoken to a number of classes, and I've been really glad to have been given the opportunity to do that, because I do think there are a lot of misconceptions. And again, it's a cultural misconception. But
Mhm.
it's very hard when people come into therapy expecting to be understood, and therapists don't have an understanding that a lot of what we're told about what life with illness is like or should be like is very far from the truth of it.
Yeah. And Christina, it sounds like similarly for your journey, when your husband had, oh, we have BPPV, that we've got it, and there's this simple little
Mhm.
maneuver, and it's going to be, you had sort of this notion as well that there's medicine and it will be cured.
Mhm.
What was it like for you when that finally set in, or when you really allowed yourself to um, grapple with the idea that your husband has a chronic illness?
Mhm. The first year was really hard. I just kind of pushed through. I didn't stop and think. I was like, I just need to give him every attention, every like bit of me that can research, all my free time. I have to take care of the kids, make sure they have like a normal day-to-day life. I'm fine. I'll be fine. That's what I kept saying. And then something would happen. He would get upset with me, and then I would just lose it. So it was definitely hard the first year. It was us getting used to our roles. He was like, you need to leave. You need a well person. And I'm like, what are you talking about? And he was like, the kids can't, this isn't good for the kids. It's not good for you. But I'm like, no, I'm here by your side no matter what.
Mm.
And I mean, the first year was rough. And then we kind of got a relief the following June. One of our rabbit holes led us to TMJ, and he got like a splint or something like that, like some kind of dental stuff. Coincidentally, I'm not sure, but he went into remission for like a year, and he was great. And I was like, phew, okay, another BPBD thing
Yeah.
again. And I'm like, all right, that was a rough year, And then it kicked back up a year later. But for a little bit, it was definitely not easier the second time around, but I think I was more well equipped to deal with it. But it's still a process.
Well, you're talking about something really important, Christina, about learning how to manage. This is new. I mean, I'm so glad that you're doing the work that you're doing, kind of sharing with people what your experience has been, because I think that helps normalize the process. That nobody knows how to manage something like this when it happens. It's completely, you're thrown into an entire new world. And I think we're so hard on ourselves often of, I should know how to do this. This should be better. But I think normalizing that idea that, whoa, I've just been thrown into a totally different country. I don't speak the language. This is going to take some time figuring this out, giving ourselves grace. It's really important.
Katie, you are speaking to me. I am one of those people who I feel like I should know how to deal with this.
Of course. Yes. Yes.
Yeah.
So I'm curious, when you're counseling someone with a chronic illness, how do you bring in the family component?
I'm always very interested in, for any of the people with whom I work. I mean, we as much as we're such individualists in this country, we are interdependent. And I think chronic illness brings up such issues of dependency for people. So I always want to stress that we are all dependent, every single one of us. So I'm always interested in how people's family relationships are going, where they find supports, what could be shored up. But as Christina is articulating so profoundly, illness doesn't just affect the person that is suffering with the symptoms. Illness affects spouses, partners, children, parents, siblings. So to me, the family is very important. It's important for the person living with illness, because obviously illness is such a stress that if we can support and grow those family relationships, that can be an important factor for the person living with illness, but also for the care partners who have their own set of struggles managing this new reality.
And just to continue on that, do you see the care partner within the clinical setting, the counseling setting, or do you recommend that they see a separate counselor? Or
Yeah, I have and I do, but it's mostly a 1 or 2 or 3 off. It's my work individually. I mostly see individuals. So I have some people in therapy who are the care partners. That's my client. I have other people who are the people living with chronic illness. So when I can be of use in terms of helping clarify issues or getting communication going, something that needs immediate and sort of direct assistance, I'll do that. But in terms of seeing people long term, I recommend that people see a different, just so they have their own work, their own person to speak with.
I think that makes sense, especially because they're so defined in this care partner role
Yeah.
that it's probably just a relief for an hour to be able to access different parts of themselves that may need some air.
I love working with care partners. I should say I'm a care partner myself. My husband has transverse myelitis. He acquired that several years ago, but it's a very different, it's connected, but a different experience. So I'm kind of on both sides of it.
Wow.
But I really like working with care partners. I especially like getting at the very normal feelings of anger, of despair. These are normal, expected feelings when dealing with issues like this. So it's very gratifying to create a space where people can talk about that and feel less guilty about it. Feel like, of course I feel this way. Who wouldn't? This is okay. It's important to acknowledge these darker feelings.
Yeah, I imagine, Christina, you have faced a lot of the full spectrum of feelings. And I'm curious if you can name some of the ways that this experience is affecting you and your kids, and maybe even changing you.
I mean, it's just like our whole world view. He was he was very successful. He was very successful at what he did. I was a social worker. I got to live my dream and not worry too much about finances, which was nice. And we had, we could do anything we wanted. We would take the kids skiing. We loved to go hiking, all that stuff. And then now it's, the diet is so limited. It's pretty much chicken at this point. That we don't go out to eat. If we go skiing, it is stress and worry that on the way up, he's going to have an episode, that there's going to be an episode on the mountain. Should he even be snowboarding? When he does, he can only do 2 runs, and it's just all of the stuff. Our life was just, now he's on disability now. Still trying to fight that process because that's a hard one with vestibular disorders. They love the ankylosing spondylitis, but do not like the Meniere's. They say it's a 2-week issue. I don't know how they say it's a 2-week issue, but that's what they say. And I wish it was a 2-week issue. So it's just, watching him lose his social connections because he can't do anything. He doesn't socialize. I really can't make plans because I never know, because he might be he can't watch the kids, he can't do this, or I'm just too stressed out or too exhausted to even make plans, and have that, just thinking about it just tires me out. So just lots of, it's a long journey, but I've definitely built up some skills and strategies through the time, like mindfulness. I always hated that word. I would tell my students, oh, we're going to do mindful, do deep breathing. And I never did that myself. And then I got to the point where I found it was like survival to do it. And I one day realized, going up the stairs, because he was laying in bed and I was afraid what I was going to see, I found myself just going one step at a time. And I was like, oh my gosh, I feel so good when I do this, just thinking about one step, nothing more.
You're talking about grief. I mean, I think that's a real part of living with chronic illness for both a person with the symptoms and the care partner. It's like someone has died. Your life has died. I'm not overstating that. I think there's a lot of grief, and it's continuous grief, right? Exactly what you're talking about. Everything that grief contains: the mourning for what used to be, the fear of what's going to come. And it's continuous, and grief is exhausting, as we know. I just want to underscore that when you talk about mindfulness, super important. Glad that that's working for you, but you're going through a continual grief process.
Yeah. It's never ending.
And it occurred to me while you were talking, Christina, along that note that Katie's mentioning, that it's almost as if the care partner needs care partners too. And if you're, even as simple as your husband's doctors, if they're not understanding his diagnosis and you're just going to these appointments, not feeling supported, but frustrated, you're not getting the support, because it needs to be a team. And if you don't have those team members that you can trust, then it is all on you. And the grieving that you need to do may just have to, sit back here while you're managing all the other things. And I just, I hope that part of it just is making me think about the part of resourcing ourselves involves building a care team that isn't just for your husband, but also for you.
Yeah, that's an interesting point, and I want to put a pin in that and maybe talk about that later on. What who is your care team? Do you have support, that other people that you can rely on?
Yeah, we have family that's in Florida and Maine. So that's hard. If I call and say, hey, I really need you out here, they'll come, but that's not my personality. I'm independent. I've chosen to live far away. I can do this on my own. I'm a strong person. But it's like, so no family. And with friends, it's all even them, they really don't know the full depth of it all. And I think a lot of people don't understand chronic illness, because it's still like, oh, how is he doing? Is he better now? No, he's never going to be better. Even relatives like, wait, what? He's still dealing with that? Yes, it's chronic. That means long-term, forever, possibly. So it's hard. I mean, but I feel like my husband has been my care partner too. So in a way, I like when I'm having a hard time, I try not to show, and he's like, no, it's okay. You can show me. So I think he's been the most supportive. And hopefully
I think that's fantastic what you just said. I see this in couples a lot, that there'll be a distance because the care partner will say, well, I can't possibly burden him. Like, he has enough. I don't want him to feel guilty. And the person with the symptoms, with living with the illness, will say, oh my God, she does so much. I can't. So there'll be this silence. It's so great that I think it's really important that you can communicate your feelings to one another. And I'm glad he makes that space for you and says, I want to hear what this is like for you. It's important.
Yeah.
So, and I do. I have
Katie,
that guilt too.
Yep.
It's a process. I mean, this is what relationships are about, is learning to communicate, really. I think we all have that in some way. So I'm curious for both of you, but I'll start with you, Katie. Do you find that the needs of the chronic illness patient and the needs of their loved ones are ever in conflict?
Sure, all the time. But our needs are always in conflict with family members, right? I think we get funny around illness because we say, oh God, it's so hard for them. We can't possibly make it harder. But that's the nature of bumping up against each other in a family or a friendship, right? I think normalizing that like sometimes it's going to be a struggle. But I think with what Christina was saying, it's so beautiful that she said, well, he's my care partner too. It's clear that they have found a way to share the issues of chronic illness, both her issues and his issues. And the research shows, and I've seen this, that when partners can share that, can see this as a shared problem, that our needs conflict as individuals, but as a unit, as a partnership, where do we move? How do we maybe compromise? So you get some of what you need, I get some of what I need, but we're really looking at what's best for this particular unit, whether it's a marriage or a family or a parent-child dyad. And I think that idea of we're going to bump up against each other, that's only natural, but we're on the same team. So how do we win as a team? That changes everything.
Yeah. Something that my husband is a psychotherapist, and I am not somebody who easily talks about my emotions. So something that he has taught me is to not say this is to not make it about him, but to say this is how I feel, and then it's about me. It's not about him.
Yes.
So Christina, I think that it's completely valid for you to say this is how I feel in this in this situation where I'm frustrated. It doesn't make it about him. It's about you.
Yeah. And I think that's where some of the mindfulness practice can come in. My husband and I, we went through 8 years of this, and still going. Me with my vestibular disorder, and in the earlier days, Christina, we were a mess. I mean, and it literally almost nearly broke us. And there was a building of within myself, I had to build a tolerance for the gray and a tolerance for the tension of the opposites without resolve. And I think that's where mindfulness has been helpful for me, because it's about just allowing the mess and the lack of resolve to be okay. And instead of going, oh my God, and then freaking out even more because we have conflicting needs. And so that's been an exercise. That's been, as a vestibular patient, that's been an exercise for me to just be like, yeah, I'm dizzy. I have, it's okay. But also to have that conflict and let it be part of the relationship instead of just red alarm bells. And it seems to take some of the edge off of it, when it can just breathe a little bit and go, man, this sucks right now. And you have this need, I have this need, and we don't know what to do. And, you know, I don't know why that, but there is some sort of grace that maybe what you're talking about, Katie, where you see yourself as a unit and you're kind of in it together.
And I think it's looking at reality, right? I mean, and we're so terrible at gray areas in our culture. I mean, we don't. That's a whole other podcast, right? But we're so bad at it, and we spend so much time trying to run away from. Just give me something solid. I can't bear it. And there is I think the word grace. There is a grace, a trueness about acknowledging reality, the grayness of reality, the pain and the love sitting together, the anger and the compassion sitting together. I think it's so, we've not been taught how to do this. We don't have a lot of role models for how to do it, but there is something almost sacred, if I may use that word, about the moments. We don't, unless we're a Buddhist monk, and maybe not even then, we don't stay there, but the moments that we find those spaces, and there is something sacred about that, I think.
Yeah, beautifully said. I love that. Christina, I just so that some of our listeners can lay their stories into your story and feel themselves heard here, I'm curious, can you sort of define what your roles are as care partner? What does that look like for you?
So basically, I don't know. I take on the bulk of the child care. It's just assumed. I think that that's easier for me to think that I'm going to take it all on. And then if he's able to do something, great. I probably take on too much just for trying to prepare, just trying to see if what I can do so that he won't have an episode or he won't feel disappointed when he can't make like one of our kids' events, or, prepping our kids. It's like, if he's having an episode, it's getting him his water. What does he need to eat? Can I help him to the bathroom? So, because he can't walk, explaining to people what's going on, and just trying to make them understand. I don't know. It's just whatever is needed of me, basically. I don't know if that makes any sense at all. I'm just trying to, I mean, it all changes from day to day. It depends. It's a good day. I let him take on more responsibility because it is good for him, because he does need to feel that he's contributing and that he's able to do things, because he's not a child. And so when he tries to do something, I have learned to back away and let him do it, when before I just wanted to do it for him. But there are some days when I just need to do things for him. I also attend doctor's appointments when I can, and try to help him with remembering the whole process. Sometimes our memories collide and the doctor just looks at us like we're crazy. But, I'm still there to see. And then I take notes to help him remember what the doctor said. I've written letters to doctors because he can't articulate. Wrote letters to disability, just to help them understand. I don't know, kind of whatever is
everything.
Complicated. Yeah. It's a big job. I mean, it sounds like you're his protector and his emotional support and
advocate
in between.
Yeah, I used to be a case manager, so I tell them sometimes, I'm like, I feel like a case manager, but I'm like, I know this role. This makes me feel like I have control. So let me create these spreadsheets of doctors. Let me write these emails.
Right.
It's like, okay.
Yeah, it probably is different for everyone, because as you said, that is kind of your, I guess, your personality and also what you've been trained to do. So Katie, if you're counseling a care partner, what would you say to them about what their role is in supporting their loved one?
I think you're onto something when you talk about personality type, natural affinities. I think that's right. It can and does look different with every care partner, chronically ill person. I'd like to make sure that their needs are getting met as well, that they're not involved in things that they don't want to be doing, that feel too hard for them. Often I'll inquire about getting help. Can other people come in and do some of the things that they're feeling overwhelmed by? And a lot has to do too with the wishes of the person living with the illness, especially with spouses. It's a negotiation of what each person feels comfortable with. And that's when really good communication between the partners is a real asset. The idea of, I love you, but I really feel overwhelmed doing having this particular role in caring for you. Is there a way around that, and for the partner to understand that and say, this isn't a rejection. This is my partner being who they are, and they prefer to be assisted in other ways, not in this particular way.
Yeah.
And I also think it's really important for the care partner and it's hard when you have kids. I mean, Christina, you're at the stage where you're caring for kids. So I'm imagining some days you're just like, I just give and give and give and give and give, that. And I think that's very hard. I would be inquiring, is there a place where you can take? Where can you get fed? Because it's really important.
Mm-hmm.
Yeah.
Mm-hmm.
Yeah. I want to know, where do you get fed, and how have you learned to take care of yourself through this?
Mm-hmm. Well, work is actually a great place for me. I go there, I know what I'm doing. When I leave, I'm done for the day, so I go there. I don't have any I have crises because I'm in mental health, but, I have a support system behind me. I have police if I need them, I have backup and I know what to do. There's protocols. So for me, work is a place where I feel successful and I feel good. So that's great. When summer came around this time, because I'm off for the summers, I fell into a depression the first week. I was I don't have my place. I don't know what I'm doing. I don't have a routine. I'm with my husband. I can see all the things he can't do during the day. So then it's another mourning process.
Wow.
But I would say one of the biggest things that's helped me is hobbies. Luckily, not luckily, but COVID got me back into photography because I was like, oh, I need to do something. And I love photography. And then when he got sick, it got me through. Even just thinking about doing photography helped me when I was having a hard time. And it was this place where I could be in the moment and present and just take random pictures of things.
It's also about you, about your expression, your voice. I'm a big believer in hobbies, especially creative hobbies for both care partners and people living with illness. And exactly, you just said it so well, that you're present, you're in that moment. The cares of other people's needs kind of are gone. It's just you in the moment expressing your own creative voice. It's so powerful.
Yeah. I haven't seen brain imaging of when somebody's in the creative process, but I imagine it shuts down some of the amygdala and the fight or flight and all of that needs to rest. And it'll get triggered again for sure, but it's restorative.
And you also mentioned, that you've taken up mindfulness, which is, it's definitely part of, caring for yourself, because it's a tool that can bring down that, that anxiety. Do you do any, relaxing things like, taking a day where you get, I'm making this up, but, you get a babysitter other than your husband, so that you have this day that you could go shopping or go to the spa or something, whatever it is that helps you to relax.
Yeah. And that's the nice thing about summers too, is that my kids go to camp and I know they're having a great time. They're with their friends. I still feel guilty, because I'm oh, I should have them home. They won't be young forever. But I'm at the same time, I really need this. I need this time.
You do need this. Absolutely. You absolutely need this. Yes.
Yeah.
So Katie, how can care partners balance their own needs without making their loved one feel guilty about their limitations and that the illness places on the family, or kind of reframed, what are some strategies of self-care for care partners?
Sure. I think most, if not all, I'm trying to think of the dyads that I've worked with in this regard, the person that's ill is saying, for God's sake, go, please take a day, go do something. And I think the care partners have to listen to that, right? That 9 times out of 10, the person ill is saying, I feel bad that I keep you, and I want you to go do something. Trust them, believe that. I think that's number one. I also think having, especially for spouses, having dates. And I know when the person doesn't feel well, it's really hard to have a date. But even, is there a program that you watch together that makes you smile or that you can talk about? Being able to count on time together that's not about the illness, that's about, just spending time together, I think can be really helpful. Can also count as self-care for the partner and the person with illness. And I think letting go of the guilt. I mean, Christina, you were talking about feeling kind of guilty with your kids going to camp. Like, let go of that guilt. That is not serving you. Just goodbye. Let it go. There's so much already in our culture that says that women especially have to be all things to all people. We can't. And you're living with big things when you're living with a chronic illness in the house. Get rid of the guilt.
Yeah.
Katie, I wish you could be my therapist.
I know. I was just thinking, like, how much room do you have for more?
Well, it's really funny that you say that, because my husband just yesterday, as I was, shooting on myself, I should said, you don't tell your client, you don't do for yourself what you do for your clients. It's a work in progress. I think we all, can go easier on ourselves and give ourselves some grace.
Absolutely. And we can all use a therapist, whether we're in a good place or consciously struggling with an issue. It always helps to have someone reframe our thoughts and say, did you just hear what you said? Or can you see what you're doing?
Yes, absolutely. And I want to stress, I'm a big proponent of therapy, obviously, as a therapist. I think it's incredibly helpful. But people living with illness, whether as the person with the symptoms or the caregiver, it's a tremendous stress. I think sometimes people in the situation lose sight of that. There's a sense of it becomes the normal, and they just think, well, what's wrong with me? I should be able to be better than this. I should. And it does help to have somebody from the outside look in and say, you're living in a war zone. Like, wait a minute, let's step back from this. I think being reminded of the immense challenges that this brings is really important. Give some perspective.
Yeah.
Christina, I wanted to talk a little bit about the Facebook group that you're helping Vita moderate, that is specifically for care partners. It's called Vestibular Voices of Care. And I know that we've had this platform for a while, and we have had a difficult time getting people engaged. I'm wondering if you want to talk a little bit about the platform and why you think that might be.
Okay. I don't know. I feel like there's something with care partners that it's just not very, I don't know if they're not tending to seek out help, or I don't know what it is. I've seen it through my blog, and it's hard for people to talk about it. I think they might feel guilty. Like, they're not the sick ones. Why am I complaining, or why am I trying to seek help? Or they just don't have time, or they're worried that whether their partner will see what they've wrote. Because I'm on lots and lots of Facebook pages for support. There's some that have thousands and thousands of people on there. That's usually, it's just been a long time in the making for that. I just think giving it time and having some people take some chances and really spreading the word to loved ones that, yes, you need help too. There's a community. It feels so much better when you find a community. I know I've reached out a couple of times to one of the Facebook pages when I was having a hard time, and within 5 minutes, I had like 15 people saying, I know how you feel. You've got this. It is hard and we understand. And so I'm hoping we can get Vita's carers page up to that. So I'm going to keep posting. I'm hoping my story resonates with some people and they feel comfortable sharing too. But I really want to create that community because it's really hard to find other people.
Well, I'm imagining after this conversation and hearing your vulnerability, Christina, and Katie, your wisdom, and it really like you said in the very beginning, Katie, it normalizes this process, and maybe people just need a little bit of that extra nudge to go, oh, this is part of it. This isn't an accessory. This caring for myself and talking about the process is a normal, essential part of it. So hopefully some of that, the pain and the joy and the ease and the discomfort and living in the gray with this messy chronic illness experience can become more easeful and graceful.
And you can get support from your peers. And I just want to reiterate that this Facebook group, it's a closed group. It is a safe space where only care partners participate. It is not for patients, so you don't have to feel worried that you're going to say something that's going to, hurt someone else's feelings. This is a place to express yourself and be understood by people who are in the same position that you're in. So that's Vestibular Voices of Care on Facebook. We'll put a link to that associated with this podcast.
Yeah.
So again, thank you both. We always say we could go on, and I feel like that again today too. I feel really nourished by this conversation, and I want to thank you.
Katie, one last thing. I'm imagining, I think with licensing, you probably can only practice within specific states. But if you have a link and there's someone listening that is from Missouri, we'll add that at the bottom.
Please do. I'm licensed in several states, and I'm never averse to people calling, even if I'll help connect you with somebody. I've got a national, even international network. So that's my pleasure to, when someone calls and says, I'd like somebody who's familiar with chronic illness practicing in Arkansas, to say, let's see who we've got and give them some names.
Great.
Wonderful.
I'm going to give your name to our community resource coordinator so that when people contact us, she has a name to give them.
Absolutely.
Thank you all. This is incredible. Really touching conversation.
Yes. Thank you for being vulnerable, Christina. And thank you, Katie.
Thanks for having me. Thanks for listening.
Yes.
Bye-bye.
Bye-bye.
Thanks for tuning in to ICU this month.
We hope this conversation sparked new understanding of the vestibular journey. And for all of our patients out there, leaves you feeling just a little more heard and a little more seen. I see you.